This session will be recorded and we will send out the recording in about a week. While we wait for others to arrive, just so we know who's here, if you wouldn't mind just putting your name, your organization, and city and state so we know who to customize this webinar for. Okay, I'll get us started. Welcome. We are happy you can join us for today's webinar. While we wait for others to arrive, just a reminder that you can put your name, organization, city, and state in the chat just so we can see who's here. Today's webinar will cover body mass index assessment and diabetes prevention. Before I move on to the learning objectives today, I wanted to review some housekeeping and reminders. You can hear us, but we cannot hear you. You can use the chat to ask any questions that we'll answer at the end of our content today. If you wish to have closed captioning turned on, there should be a button on your screen that either says CC or closed captioning. And we will also have a set of evaluation questions at the end of the webinar that we encourage you to complete, as it helps us to provide the best content and tailor it to the voices of those in the field. This session is being recorded and we will send out the recording in about a week. Today's learning objectives are: explain the relationship between BMI, obesity, and type 2 diabetes risk in children; identifying key risk factors and early warning signs of prediabetes in children; and discuss prevention strategies, including lifestyle changes that reduce diabetes risk. And now an introduction. My name is Mandy LeBlanc. I get to be a contractor with the School-Based Health Alliance. I have over 20 years of experience in education, healthcare, and school-based health. I was a 2016 Leadership Fellow for School-Based Health Alliance and have experience in the field as well as advising through our consulting program. I'll toss it over to Donnie.
Hi, everyone. My name is Donnie Greco. I'm an associate here at the School-Based Health Alliance. I've been here for about 3 years, and I'll be here in the background trying to answer your questions and help out with the chat. And with that, I'll pass it over to Gone.
Good afternoon, everyone. My name is Gone Jill. I am a registered nurse by training, turned to project manager. I've been with the School-Based Health Alliance for about 2 years now. Prior to coming to the School-Based Health Alliance, I like to say I've worked at pretty much every place where you can find kids, from hospitals to homes to schools and clinics. Most of my experience has been in an FQHC, working as a pediatric nurse and working through a lot of clinical training and workflows. So I'm really excited to be talking to you all about BMI and how it can help us to prevent diabetes, specifically type 2 diabetes. So before we get started, I just want to gauge here who's all here with us. I see you all introducing yourselves in the chat. If you can just add in what type of organization or sponsoring organization, if you're an FQHC or if you're in SPHC, you're coming from. So is that an FQHC, FQHC lookalike, a health department, a school? Just share in the chat the type of org. So I see FQHC, medical center, or a hospital. Okay, I see some providers, school-based health center, some school clinics. Perfect. So looks like we have some FQHCs, some providers, and those from the school-based health centers. So let's jump right into it and start with some what's before we get into the how. So I always like to start with just some descriptions and definitions. So what is BMI? BMI is a screening tool that is used to assess the weight status of our patients. Typically, it is calculated using weight and height. In adults, you typically see BMI as a range of 18 to 40, but in children, they come out as percentiles. Do note that BMI helps us track growth trends over time. It is not a diagnosis tool. And one thing that we've learned over the last several years is that BMI is not the most accurate way to define obesity because it's limited to a person's weight and height. It does not account for muscle mass or fat distribution. So when taking BMI prior to giving that obesity diagnosis, we want to make sure that we are looking at all parts of that patient. What is their weight? What is their weight? What is their height? What is their fat distribution? What is their waist to hip ratio? What are their metabolic indicators? All of that prior to giving them the diagnosis. So as I mentioned, BMI for children typically comes out in percentiles. So you'll see it as 0 to 5th. So sometimes it'll be like below the 5th percentile. And that means that they are underweight. 5th to 85th percentile, this is what's considered normal or healthy weight. 85th to 95th percentile is considered overweight. Over 95th percentile, equal to or greater than 95th percentile, is considered obese. And then in the recent years, the CDC actually expanded their growth charts to be able to capture those children that are above that 95th percentile, because prior to, it was capped at the 95th to 97th percentile, which limited the ability to be able to track those children who are obese or severely obese over time to see how they're doing. Like, are they continuing to go up on that trend, or are they coming down? So as of 2022, we have a screenshot there of the most recent type of growth chart, which allows us to see those within the severe obesity category. So it can go up to 120th percent of the 95th percentile. All right, so what is prediabetes? Prediabetes occurs when the blood sugar levels are higher than normal, but not high enough to be classified as type 2 diabetes. Typically, it is a warning sign that the body is struggling with insulin regulation. So oftentimes, prediabetes is reversible with some lifestyle changes. However, without intervention, up to 70% of children with prediabetes develop type 2 diabetes. All right, so what is type 2 diabetes? In this presentation, we are focusing on type 2 versus type 1. Type 2 is a chronic health condition. It occurs when the body doesn't produce enough insulin or doesn't use insulin effectively, and this results in high glucose or high blood sugar levels. Historically, type 2 diabetes is an adult disease, but this has changed over time. So we're seeing that there's a youth onset of type 2 diabetes that's becoming more and more common. And the majority factor of this is the rise of childhood obesity, which is closely linked to the development of type 2 diabetes. If not properly managed, type 2 diabetes can lead to serious complications such as heart disease, kidney problems, and nerve damage, and we don't want that to happen to our kiddos. Unlike type 1 diabetes, which is an autoimmune disease, type 2 diabetes is largely preventable with healthy lifestyle choices. However, unlike prediabetes, it's not reversible, but it is manageable. So talking about BMI and type 2 diabetes, what's the risk? What is the link? Typically, we're looking at excess weight. And with BMI, we're able to assess that weight and track those trends over time. Excess weight can lead to insulin resistance, which means that the body does not respond well to that insulin. This can result in higher blood sugar levels, thus increasing the risk for developing type 2 diabetes. So when we're looking at our BMI, we are trying to capture what is the risk level for this child to have obesity, which can lead to a higher risk of them developing prediabetes or type 2 diabetes. So the BMIs that we're really focusing on is those that are equal to or greater than the 95th percentile. So the higher the BMI, the higher the risk. Also note that BMI is not the only factor for developing diabetes. Other contributing factors include genetics, lifestyle, diet, metabolic risks such as high blood pressure, abnormal cholesterol, Signs of insulin resistance, as you can see there on the screen, which include acanthosis nigricans, which is often visible as dark patches on the skin, typically on the neck or in the armpits, as well as early symptoms of elevated blood pressure, elevated blood sugar, such as frequent thirst, urination, and fatigue. And also understand that we don't just jump to obesity and then type 2 diabetes. There is a progression. So typically it's obesity, then prediabetes, then type 2 diabetes. But the great news is there is a window of opportunity for early intervention during that obesity and prediabetes phase. All right, so identifying at-risk patients. So a lot of you that are clinical staff, you know this stuff. I'm just saying this for those that may not be as familiar. So some of those risk factors that I mentioned previously, such as having the higher BMI, the family history, signs of insulin resistant, metabolic risk, and having a poor diet and sedentary lifestyle. These are all ways to identify students and patients that may be at a higher risk for developing type 2 diabetes. Things that we can do is if you're doing an annual BMI, whether you're doing it with your well child visit or with any other visits, being able to identify those students and patients that have a higher BMI and just doing some follow-up with them. So this may look like some annual screening, some additional education, or just tracking those trends over time to see what is happening, because we know that BMI is not a diagnostic tool, but it helps us to see what's going on and helps us to understand how those trends are going. Family history, we know that those that are coming from a family where a parent or sibling with type 2 diabetes have a higher risk of developing it as well. And then the other signs and symptoms that are listed on that screen. So what can we do? Spotting risk factors early can help us to intervene before diabetes develops. And this can look like screening early and screening often. So screening annually for our BMI, as well as promoting a healthy lifestyle with the whole child and the whole family in mind. So I'm going to pass it over to Mandy, and she's going to talk us through some interventions.
I'm here to cover some intervention strategies, and we can head to the next slide. Yep, we've got the balanced nutrition, daily physical activity, healthy sleep habits, and limit screen time. So I'll just let you pause and look at that for a moment and think about those 4 areas. Great. Engaging the whole family, habit changes work better together. And finally, individualized care plans for weight management. And coordinate with specialists, nutritionists, endocrinologists, and behavioral counselors.
I do want to add to this as well. As you can see, some of these strategies, it's not just focused on counseling, it's focused on holistic care. So when we're talking about counseling our students and patients about their lifestyle choices, it's not just about the food that you're eating or the physical activity. Some of that is also like your screen time, your sleep, things that can affect your mental health as well. So being able to take that holistic approach of let's talk about how to be healthy in the best way possible, and not just let's talk about how to eat better and how to incorporate more exercise. So those are things that you can include in effective counseling. The approach of the whole family. I participated in a MEN program about 5 years ago, where the approach was you teach children about healthy eating habits and you teach them how physical activity is fun, but you do it as a family unit. So it's not about let's focus on giving that child the education. It's let's get the family the education so that they can make a change together. And then with individualized care plans, it's not just about weight management. It's about how can we stabilize your weight, and how can, if needed, how can we lose a modest amount of weight? We don't want them to lose or feel like they have to lose like 20, 30 pounds in a short amount of time. So really being able to meet that patient, family, student where they're at. And of course, care coordination. So if you are in a school-based health center, if you're in a QHC, if you're in a hospital, being able to know who's within your network. You may or may not have a nutritionist on site. So being able to see who can I reach out to, who can I refer to, who can I coordinate with, and if they're needing a specialist like an endocrinologist, being able to pull them in, behavioral health counselors as well, because sometimes eating could be a sign of some behavioral health issues if they're not able to regulate that. Back over to you, Mimi.
Thank you. And now I get to dive into how to make those changes happen. So, about 10 years ago, I got to work on a program called Hallways to Health, where I was embedded in 2 schools in Seattle, helping youth that were in the prediabetes phase and having conversations with them. So my degree is in communications and visual media, but I've done a lot of work on health and behavioral change. And so I was able to come up with a list of things that I'm excited to share with you today. But essentially, the goal is to find the balance on facts and compassion, focusing more about what to infuse rather than what to remove from people's daily lives, focusing on building blocks on 1% improvement per day rather than major overnight changes that tend to be less sustainable. When we talk about BMI, we want to focus more on giving them the facts and focusing more on showing compassion. So when we focus on showing care for someone's health, that tends to be better received than the perceptions that we're making any judgments about somebody's weight, and allows for better conversations and dialogue, which can lead to the person verbalizing what they want to improve, which brings us one step closer to positive outcomes. Going to do a bit of a deep dive here on motivational interviewing because this is a key area in this topic today. So I've personally seen strong positive impacts from motivational interviewing, which is a client-centered counseling approach that helps individuals explore their feelings about change, readiness for change, and their motivation to take action in different areas of their lives. It focuses on enhancing motivation and commitment to specific goals rather than directing or advising someone. This approach can be particularly effective with someone who is ambivalent and is designed to guide people through a process of change. It allows a welcoming dynamic for building trust and support in the relationship between you and the person you're connecting with. It makes the other person understand that they have control over their outcomes and you are there to be their guide. By asking open-ended questions and summarizing their responses, you allow the other person to be in control and drive the conversation a bit more. The 4 stages of motivational interviewing are pre-contemplation, thinking about any behavioral change, contemplation, preparation, and action. The 5 A's of motivational interviewing are asking. That means asking open-ended questions about health behaviors, readiness to change, reasons for wanting change. Then advising, based on specific circumstances and needs for each individual and potential benefits for change. The 3rd A is assessing, which is understanding the risks and benefits associated with someone's current behavior and assisting with sharing the resources and support for proposed actions and helping to overcome obstacles. The 5th is arranging, which focuses on next steps such as follow-up appointments for check-ins. I got to experience a motivational interviewing training through the Hallways to Health program that I was engaged in, but there are a lot of free and low-cost virtual trainings available online. Focusing on nutrition and physical activity recommendations. Another way to help youth have more control over their quality of life is to teach them how to read labels so they can make informed decisions about their nutrition. Pointing out things such as the number of servings per container, the amount of protein, which is a goal in getting plenty of protein each day, the amount of sugar. A lot of times people are surprised by how much sugar they see in labels. The sodium content, teaching them about saturated versus unsaturated fats can all make a difference. I've seen countless times where people just have not realized what servings, how many servings there were, and what to look for, and which can make a big difference. Up next is a program that I've used personally and had a lot of success with. It's called the 5210 program. It helps to set realistic, achievable daily health goals, focus on 5 servings of fruits and vegetables for the day, less than 2 hours of screen time, which is getting more and more difficult, 1 hour of physical activity per day, which again is getting, seems to be getting more difficult, and 0 sugary drinks. And so this is a high bar that we're reaching for. I added the 7 before it, which is getting at least 7 hours of sleep. So this is what I was using when I was embedded in 2 school-based health centers throughout the Hallways to Health program. I would use it to open up a safe conversation and ask each week to get to know somebody better. So when I first met with a student, they were probably reluctant to open up to me, but by the 3rd session or so of going over these and knowing what to expect, it built trust, it built a relationship that we could grow upon and allowed us to have some entry-level conversations, which then got into deeper questions. So while it may be repetitive to repeat the first 3 times, knowing that each time you're planting lifetime seeds that can be carried on for generations to come by using these questions. A side note, I want to honor the team at Penn State University for creating this 5210 tool. I got the opportunity to meet with Professor Dr. Jennifer Dinalo, who has a wealth of knowledge on this. And thank you, Donnie, for putting the link in the chat. Up next is leveraging community and clinical resources. I want to just pause for a couple moments for you to think about at either scheduling time right now, adding it to your calendar, or starting to jot down the local and community resources that you have in your community. The goal is to meet with as many students within reason as you're able to, then connect them to local, free, reduced, insurable support for sustainable success after a few sessions with them. So what we would often do is meet with a student a few times and then distribute them out into local community resources so we can meet with as many students as possible. So I highly suggest that you take a moment now to write a note to yourself, or even better, and bonus points, if you schedule time in your calendar to investigate which resources exist in your community. Up next, school and community prevention. Healthier school meals and snacks promote better choices. Physical activity during school improves long-term health and allows for chipping into that 60 minutes a day of ideal physical activity. Community resources can provide access to recreation and nutritional support. So finding ways and things that the students can do outside of school and ways to get healthy meals and snacks. School-based health center partnerships help integrate the screening and prevention efforts. So once you build out your referral pathways, which hopefully by now you've set your calendar reminder to look into local and community resources, it's time to think about how to guide students to make informed decisions about school meals, snacks, and ways to help them find sustainable physical activity to infuse in their lives. We can use motivational interviewing to help them explore what types of physical activity they enjoy to increase success rates and local community resources that are already on top of this. So the worst thing we can do is propose something that somebody doesn't like to do. Maybe they don't love running, and signing them up for a 5K, 10K, half marathon would probably not be successful. But if you use motivational interviewing to get to know what physical activity they actually enjoy, and finding groups that are already doing this so that they then sign up and do something group-based, that tends to enhance the success rates. Some people like to work out on their own, and that's wonderful. But finding something that there is realistic that they'll do is a key component. So taking time to look at and review or revise those partnerships with your community can determine win-win solutions for students. Now I get to talk about the Hallways to Health program. I got to build this toolkit and I'm very excited about it. When we look at building a wellness team, you look at who in your school could be a part of that wellness team, and who in your community would be like to get engaged. This is also a good opportunity for PTA members or PTSA. Engaging community-based organizations, which we've just discussed, scheduling some time to look into what exists. And these things are constantly evolving. So that's why I want you to schedule the calendar time to look into this. Building buy-in and engaging partners. So this is something that's ongoing, which is focused on finding those win-win partnerships. Up next, engaging youth in the discussion. So adults can look at what programs exist all we want, but getting youth to find and spotlight the opportunities and potentially put these on social media posts, etc., is likely to increase your success. Then engaging parents and guardians. Sometimes we think if we speak to the student, that's good enough. But the more we can engage parents and guardians and ensure they have the transportation they need so that they have all the resources they need to succeed. Engaging school partners. So a lot of times there are people in your school that care about this topic that just haven't been asked. Assessing conditions for wellness. That's in that toolkit, there's a way to look at what are your conditions for wellness. And this is something that I used to do. I'd go around to schools and look at what opportunities exist, because sometimes when we work in a school, we're not always seeing the new things that we could be infusing that are already easy to implement. Then creating and implementing your action plan, telling your story, sustaining your efforts, and then sharing resources and tools. Great, and here are some additional resources. We will be sending this recording and the slides in a follow-up email. Going to pause for a poll now. The poll will take place in the chat, but I'm curious to learn if you have a program that focuses on nutrition and physical activity in your school. We would love it if you could put what you're doing in the chat so you can help others. All right, we're seeing some no's, which is, to me, a no is an opportunity for a yes. Unsure, and that's okay. Hopefully the point of the call is today is to find time to connect with those in your community to start building this out, to play a key role in planting some seeds of success for your students. I'm seeing Janet says that there's not a specific plan, but when we identify students, we speak with those families. Great. So I just want to say, I don't think anybody on this call is going to get aggressive and say your student's BMI number is really high. It's more of a conversation of, here are some opportunities that we could share with your student. And I always try to put myself in the other person's shoes and think, if I were receiving this call, how would I want to hear it? Because prediabetes is an opportunity to make positive changes. Great. Okay.
Just gonna
Yeah,
add
go.
in the chat. Mandy, I mentioned participating in a MEND program a few years back. I put that link in the chat if anyone is interested in learning more. It is a program that you would have to pay to be a part of to get like the materials and such. But it is something that if you're looking to do something similar, look into it, because it is a really great approach to do that whole family approach of how can we talk about weight in a healthy manner, how can we talk about health, and how can we incorporate exercise to make it seem really fun to kids. So the main focus for MEND is more elementary school age children. So I saw in the chat, a few of you said you are in school-based health centers or an elementary school nurse. So if you're looking at maybe starting a program and not being able to afford something like MEND, maybe looking into an opportunity to do something similar.
Great. And this is also a plug-in for your local health plans. A lot of local health plans are invested in this topic and would be happy to share what they have as far as resources. And a lot of those resources are not just for those that use the plan, it's for the whole community that's already done some research into what programs exist in your community, because it's in their best interest to help you. All right. Next is finding the balance between prevention and intervention. To me, there's a fine line between intervention and prevention. In the chat, if you have any suggestions to share, please add them. But essentially, going back to that, putting yourself in their shoes and how you would want to receive the information about the topic that we're covering today, which is BMI as it relates to diabetes risk. But I like to see it as more of opportunity conversations that can occur to support that whole family health. So feel free in the chat, and I want to just highlight that Bridget is working on a project, a toolkit for pediatric obesity management that she will share once it's completed. All right, and now we get to join into the key takeaways, So I just want to highlight that BMI is a screening tool, not a diagnosis. A higher BMI is a predictor of diabetes risk, but there are other key roles in diabetes risk. Early intervention prevents long-term health issues. Schools, families, and school-based health centers collaborating can improve health outcomes, and prevention starts early before symptoms appear. Gone, is there anything you wanted to add on this? Are you happy with what we have here? Great.
It looks great. I do see in the chat that some people are sharing some programs or some opportunities of having these programs within their community. So please feel free to share, as well as any questions that you have. We love to hear what you all are doing in the field and within your community.
And I'll highlight for if anybody's listening to the recording, the website is healthyweightpartnership.org. And Janet just shared strong4life.com, strongforlife.com. All right, we've also covered some prevention strategies for patients and families, promoting balanced nutrition and portion control. There's some really fun activities that are youth focused as it relates to portion control, encouraging physical activity and movement that students will actually enjoy participating in. So we all have memories of somebody telling us we had to do something in school that we probably never wanted to do again in our lives. But we also have positive memories of physical activity that we did that we could still continue to infuse in our lives. So it's important to find something that people are more likely to do rather than assigning things that they didn't enjoy doing. And then the importance of sleep and stress management. So to me, the 4 cornerstones are nutrition, physical activity, sleep, and stress management. And at any given point in our lives, and this is youth included, we tend to have one that we're doing pretty well on and another that's a little wobbly. So I think of it as a stool and focusing on the stool that needs the most help while celebrating the others that are going well. We have some final references to share. And we even have 2 pages of references. And now we'll jump into our poll. And as we launch our poll to hear your feedback on today's webinar, this is also your opportunity to ask us questions. We built in some extra time to be able to answer your questions today. So we'll leave the poll up for a couple minutes. It's only 5 questions that we're asking today, and it's really helpful for us to tailor our future content for continuous improvement. So I really appreciate if you can complete the poll. And when we hit a certain percentage of our poll results, that's when we can start answering the questions. So I encourage you to answer those quick 5 questions. Shouldn't take you more than a minute or 2, and it really helps us.
We're waiting on that. I'm seeing some folks sharing in the chat about working with multidisciplinary teams or working with, those that may be like nutritionists, etc. And it makes me think about care coordination. So understanding that if, one part of a student or family's needs are identified, usually that kind of opens up what else is going on with you. So if their issue is I'm having a hard time managing my weight, I may be at risk of developing diabetes due to my family history. Those are opportunities for U.S. providers to also do screening. Is there food insecurity with this family? Do they need access to healthy food resources, etc.? So being able to think outside of the box of what can I do if we don't have a program in place? Who can I work with? And what resources or what other parts of our care can we tap into to understand the whole child and the whole family?
Next up, we can go to ways to stay connected with us. So you can scan in this QR code. We can leave this up for a bit as we wait for questions to come in and topics to discuss as well. So we have a Facebook page, a Twitter account, LinkedIn, and Instagram. And if you follow us on any of these, this is how we share information about future webinars. So feel free to scan that QR code. And we'll leave it on that. I just want to say thank you for those of you that could join us. We will stick around to answer questions and have discussions about topics that are important to you on this area of focus, which is body mass index and diabetes prevention.
So I actually do have some questions, and please, everyone else in the chat, feel free to type them out, share them. We would love to answer those. But one that I had was, so Goni, this might be more for you, but what were some early, like non-obvious signs that maybe parents or those in the school might miss whenever it comes to pre-diabetes or even type 2 diabetes? Like what's something that they might miss, that they might not think about, that is really beneficial to kind of talk about and have everyone discuss and understand?
That is a great question, Donnie. I know we have some providers here as well, so feel free to chime in the chat. But some of those factors outside of BMI that I mentioned, so a sedentary lifestyle, poor eating habits. So what does a typical meal look like for that child and that family? Those are things that people might not think about. Oh, this might increase my risk to diabetes or even other health issues, but it can. Family history is huge. So just because someone may not be obese doesn't necessarily mean that they are not at a higher risk if other members of their family have type 2 diabetes. So a lot of those risk factors that we mentioned, people might not think, oh, this doesn't apply to me just because, they may not seem obese. And plus we understand that with BMI, depending on, if you're Asian or African American or Caucasian, BMI doesn't really say what your risk is, because we've seen that depending on what population you're coming from, your risk may be higher or lower compared to those with the same BMI level as you. So really just being able to have those conversations with a provider, and not assuming that just because, I'm obese or I'm not considered obese, that you're not one that may be at risk for type 2 diabetes. And providers, feel free to chime in the chat.
So thank you, Gone. So I had another question. So this is more a little bit general, taking a step back. So if I'm someone working in a school-based health center and I want to start bringing some of this curriculum or this material into our school-based health center to kind of talk about with students, what's a great way to do that? What are some great initial steps would you recommend to really emphasize why this is important and how we can make it a priority to better the health of our students?
Bonnie, I could take this one while you think if you want.
Go ahead.
Okay, so I got to do this, and I was hired to step into a school-based health center and be a complimentary support to our nurse practitioner and mental health specialist. And what I found also, I want to highlight Donnie's previous question, which is some signs. A lot of times mental health can be, not always, connected to some diabetes risk as well. And so sometimes they would send me a student who was just navigating some challenges, and then I would use that 5210 conversation as that to open up the dialogue. So I want to highlight that. And it's really easy to learn and implement. We made some photocopies on some colored paper, and we would start handing those out when we met with students. And it's a nice, welcoming way to meet with a student. It's not saying, I looked at your numbers, we're really worried. Again, that putting yourself in somebody else's shoes. And it's more of how can you start to have a conversation to get to the root at some of the things. I want to also highlight a success story, which is one time I was doing the 5210, and they said that their screen time was really low. And they kept saying that over and over, that they hardly watched any TV, they didn't have a phone. And that allowed me to realize that the student was living in a tent. And then we got them additional resources. So I want to say that that 5210 tool can be an amazing tool to open up more conversations. So to get back to the asking the 5210 question, just putting that at if you go to that website, 5210, I think, .com, or Google 5210, then you can find some simple resources that are already created that you can then just print out copies of that start that conversation. And then they can go home and bring that tool to, and the student can say, look what I'm learning in school. And then also that Hallways to Health program toolkit that we highlighted in the chat as well. Okay, back to you, Gone. Sorry for taking your...
No, you're good, Mandy. You're good. So some things that came to mind for me was thinking about how we talk about food, for example. So I know with the No Kid Hungry work and some of the webinars that we've done in the past, they introduce a continuum of what are strategies that school-based health centers can use to help families navigate resources for whatever they're needing. So if you're trying to, do some interventions for weight management, you can apply some of those strategies as well. So this can look like bringing awareness and doing outreach. So letting people know, hey, did you know that our school-based health center does this? Or did you know that there's this program within the community? Or did you know we can connect you with these types of services? If there are resources in the community, being able to distribute that and share that with your students and families or even school staff. Being able to do screening. So BMI is a screening tool that we can do, but there's also other ways that you can screen to see what is going on with this child. So as Mandy mentioned, being able to use the 5210 to be able to see like what's going on and assessing, okay, how can we figure out how to best support you? So it's not always just the focus on weight, but the focus on the whole child and the whole family. And if there is a need for resources or if there is a need for additional services or specialists, being able to provide that referral, to provide that navigation, that follow-up, that care coordination if appropriate.
While
Great.
we wait on the next question, I see, I just want to highlight some things in the chat, which is the Grow Healthy Toolkit, which is spelled GREAUX, Healthy Toolkit, which is a good resource that they're sharing, and that's Strong for Life. And then also want to highlight a program that has many different names depending on your community, but essentially a Friday backpack program. So you fill a backpack, send it home with the student to share with their family. And so another question in the chat is evidence-based solutions. And so that is one where when you can provide the actual healthy vegetables and fruits to send home, you can't guarantee that the kids are going to eat fruits and vegetables. It's in their nature. Some students in their nature to not love fruits and vegetables, but when you can actually send them home with the family, that also helps improve outcomes.
Great. So, Mandy, I have another question for you.
Great.
And again, anyone else, please feel free to type in the chat. But you talked a lot about like motivational interviewing in your approach with that. How do you tailor that best, whether it be to the child's age, their developmental level, or to what you're kind of looking for? What are some strategies that you use, and like how can you implement that with this work? What are some best ways to move
Great
that?
question. I've had the opportunity to work with in daycares, elementary, middle, and high school. So, great question, because having the conversation with a high schooler is very different than an elementary school student. And so I would say getting on their level and thinking about if you're in elementary school, it's what kind of you wouldn't say physical activity, right? They may not understand what physical activity means. It's what kind of activities do you like to do with your family? What kind of sports do you play? What kind of things do you do with your family? Do you ever go for walks? And one walk that I like to highlight, we call it a rainbow walk, which is a family goes out for a walk and they stay out until they find something that's red, orange, yellow, green, and blue in their walk. It doesn't all have to be from nature. That can be a lot, especially when it's not spring. But maybe you see a blue house and you see a yellow fire hydrant, right? So depending on what you live, whether it's urban or rural, the rule is just find something that's red, orange, yellow, green, blue, and purple. And that can allow the whole family to enjoy the walk and give sense of purpose for it. And so that's an example of an elementary school conversation that you wouldn't necessarily have with a high schooler. I'd encourage them to do a rainbow walk. You might get some eye rolls if you suggest those. But in high school, it's more what kind of things would you like to do after school that allow you to put your phone down and get active with your friends, and that can encourage that conversation. So very different conversations. In the middle school, I like to think that middle schoolers want to be more like high schoolers. So I'm not saying that you get too high up in your conversation with that dialogue, but treating middle schoolers as a little bit older will get you a long ways.
Great. Thank you so much. So I have just one more for you both
Yeah.
from me. So I was thinking as we were talking, and a lot of emphasis, and even some people in the chat were saying like they use a multidisciplinary team. Collaboration is such a big idea behind this, and I think that's true in so many ways. So what would both of you say are some great ways to involve both school staff? So that could be like gym teachers, coaches, those who work in the cafeteria involved, and then those in the community. So, it's one thing, parents have a direct relationship and they want to improve their children's health, but like, how can we increase that and further it in the community and say, this is why it's beneficial for us as a whole? So it's kind of a two-part question of how can we include both school staff and those in the community with this partnership and kind of achieve that level of health, that win-win for health for students and for our youth.
Great. And I can take that first while Gone, you get to think about it if you want. So in elementary schools, for example, we used to have programs where it's a PTA or PTSA funded jogathon or something along those lines, or physical health and activity days. And those can be used as a fundraiser. So it's another win-win. I've also found that when a lot of people who work in schools do it for all the right reasons that we hope for. And so they may teach history, but they really care about their students' health. And so creating an advisory committee and not making it that you have to meet every week. Maybe it's that they email and people, just because you teach history doesn't mean you don't have additional skill sets to bring to the school environment. And so bringing those in, or maybe somebody's spouse or partner then has a connection to somebody in the community they can bring in. So maybe 3-4 times a year, sending out an email that this is what you're doing and you'd be interested in having a dialogue with somebody. And then also providing food and thank you notes in the break rooms for staff goes a long way about getting those people to open up about their connections as well, because we can only do so much and we only have our lens on what's happening. But you'd be surprised if you ask people how many people will open up and share connections in the community.
I 100% agree, Mandy, and I believe in there's no need to reinvent the wheel if there's already something existing and working. So even as a lot of you were sharing, no, we don't have a program in place, but we're interested or want to have something in place, you never know, you might have something already happening within your community that maybe, the focus is just on food, and it's just a partnership away from expanding that and including like exercise and including family engagement. So tapping into your school's resources to see what kind of after school programs do you have, or what type of resource do you offer to your families, and can we provide education? Can we provide flyers? Like, is there something that the school-based health center can do to be able to add on to that resource that's already existing? So anytime that you identify, a program or you identify a potential partnership, definitely being able to tap into that. And as Mandy said, like, you're in a school, schools are teaching multiple subjects, and some of those subjects align with healthcare. So anytime that, there was a time where I went to an after school program that was an all girls program, and I was able to go and talk to them about women's health and what you're going to go through as a teenager and how our body changes, and what are ways that you can reach out to a provider and what can you talk to a provider about. So things like that, where you can go to something that's existing and be able to incorporate a little bit of that health topic, health education, and a little bit about what you can do as a provider, what you can do as a school-based health center, or what you can do as a community health center.
Great. Well, that's all I had. Thank you both so much. And thank you everyone else for attending. We really appreciate it. If you have any lingering questions, please feel free to put them in the chat. But as we've shared, an email follow-up will occur with the slides and with the recording. So, and thank you again to Mandy and Gone for being our phenomenal presenters today.
Thank you, Donnie.
Thank you, everyone.